of the eye is a space called the anterior chamber, dictated by the image on the left. A clear fluid flows continuously in and out of the chamber and nourishes nearby tissues. The fluid drains from the chamber at the open angle, where the cornea and the iris meet. But when a person has glaucoma, their intraocular eye pressure increases. This happens when either too much fluid is produced in the eye, or the drainage channels, the trabecular meshwork of the eye, become blocked due to a closing of angle between the cornea and the iris. Next is age-related macular degeneration, or AMD. AMD is a common eye condition and a leading cause of vision loss amongst people aged 50 and older. It is responsible for 50% of all cases of blindness in Australia. There are two forms of AMD, wet and dry. The cause of both forms of AMD can be attributed to the Next is age-related macular degeneration, or AMD. It's a common eye condition and a leading cause of vision loss amongst people aged 50 or older. It is responsible for 50% of all cases of blindness in Australia. There are two forms of AMD, wet and dry. Both causes can be attributed to the accumulation and inadequate clearing of waste products under the retina, which appears drusen in yellow in an eye examination. This leads to damage and thinning of the macula. The macula is made up of millions of light-sensing cells that provide sharp central vision. It's the most sensitive part of the retina, which is located at the back of the eye. When the macula is damaged, the center of your field of view may appear blurred. When the macula is damaged, the center of your field of view may appear blurry, distorted, or dark. Over time, the blurred area may grow larger, or you may develop blank spots in your central vision. Objects may also appear to be not as bright as usual. Now, retinitis pigmentosa, or RP for short. It's a condition where light-sensing cells in the retina begin to deteriorate, which appears pigmentations in the retina, shown on the right. It's generally estimated the disorder affects 1 in 4,000 people worldwide. The first signs of RP usually occur in early childhood, where both eyes are typically affected. In the early stages of RP, the light-sensing cells responsible for vision of dim light, or rods, shown in green, gradually deteriorate. As a result, seeing at night becomes much more difficult. The loss of the rods eventually leads to a breakdown and the loss of the bright light-sensing cells, known as the cones shown in red. In the late stages of RP, as the cones die, people tend to lose more of the visual field, developing larger blank spots in their vision. So, what is this amazing physiological breakthrough that's able to restore sight? It's the bionic eye. In 2014, the first steps towards creating artificial sight began with the development of the bionic eye. It's constructed from an array of stimulating electrodes that's placed inside the eye in the retina. In 2014, the first steps towards creating artificial sight began with the development of the bionic eye. It's constructed from an array of stimulating electrodes placed onto the retina in the eye. In 2014, the first steps towards creating artificial sight began with the development of the bionic eye. It's constructed from an array of stimulating electrodes that's placed into the retina of the eye and is fed signals from a digital camera. Normally, in 2014, the first steps towards creating artificial sight began with the development of the bionic eye. It's constructed from an array of stimulating electrodes that's placed onto the retina of the eye and fed signals from a digital camera. So normally, digital cameras work by converting light at each pixel in the sensor into electrical signals that report the brightness of the light. These signals are then used to digital cameras work by converting light at each pixel in their sensor arrays into electrical signals that report the brightness of the light. These signals are then used to generate an image on the display at the rear of the camera, where normally sighted people then observe the image. Normally, digital cameras work by converting light at each pixel in their sensor arrays into electrical signals that report the brightness of the light. These signals are then used to generate an image on the display at the rear of the camera, where normally sighted people view this image. So, in a bionic eye, a camera-mounted pair of glasses is used instead, where the visual display is bypassed and electrical signals are sent from each pixel in the camera to the array in a retinal implant. When placed into the eye of a blind patient, the electrodes stimulate the nerve cells that normally receive input from the damaged or deteriorating photoreceptor cells in a normal retina. These signals are interpreted as if they were coming from normal photoreceptors, so as a result, they send the information via the optic nerve to the brain, which in turn experiences a pattern of electrical signals that replicate those experienced in a normal eye. This type of system for a bionic eye is currently in trials across the world for people suffering with retinal conditions causing blindness. Oh no. So in a bionic eye, a camera is mounted. A camera-mounted pair of glasses is used, where the visual display is bypassed and electrical signals are sent straight from each pixel in the camera to an array of stimulating electrodes in this retinal implant. When placed into the eye of a blind patient, the electrodes stimulate the nerve cells that would normally receive input from the damaged or deteriorating photoreceptors. These signals are interpreted as if they were coming from normal photoreceptors. So as a result, they send the information via the optic nerve to the brain, which in turn experiences a pattern of electrical signals that replicates those experienced by a normal functioning eye. So this type of system for a bionic eye is currently in trials across the world for people suffering with retinal conditions that cause blindness, such as age-related macular degeneration and retinitis pigmentosa. But what about eye conditions that affect the optic nerve, such as glaucoma? Well, for people suffering damaged optic nerves that are unable to send full-strength electrical signals to the brain, scientists have created an implant that bypasses the damaged optic nerve completely and is placed directly into the brain, where wiring is used as an artificial optic nerve. This type of bionic eye is still waiting to be approved for trials. So, with the bionic eye seeing rapid advancements and successful trials globally and within Australia, you could say the future is starting to look bright for blindness.